Hello, I'm Robert McMullen. I'm a psychiatrist. I've been in practice 36 years, mainly using medication to treat all sorts of psychiatric illnesses. I went to Georgetown Medical School and did my residency at Columbia. Although I have always specialized in using medications or the large device called TMS, I want to talk today about using behavioral changes as well as changing your way of thinking in order to avoid depression. One of the most important things involved with our mood is having a regular sleep pattern. So you should work extremely hard at sleeping at night at what's called a normal time, like say midnight to 8 a.m. or 11 p.m. to 7 p.m. And you should avoid sleeping over 8 hours. You can remember it this way: sleep causes depression and lack of sleep helps depression. If you allow yourself to sleep in till 10 or 11, after a few days you're very likely to start getting very depressed. And you can actually pull someone out of a depression by waking them up early in the morning. So if you have somebody wake you up at 4 a.m. and say, let's go fishing, and they drag you out of bed and you're really tired and you're very depressed, and you've been depressed for 2 months, and then you finally get out there and you're in this little boat and you're out fishing with your friend and you're talking about old times, around 9, 10 o'clock, 11 o'clock, you're starting to feel really good. And you think you're feeling good because you're out fishing and talking with your friend, when it's because you were forced out of bed at 4 a.m. And this has been shown many times that if you cut off the last half of a person's sleep, the depression will lift. The problem is it usually only lifts for about 1 day. And there have been efforts to lock it in by having people sleep just that first 4 hours every other night for 3 nights, and then try to consistently go to bed earlier, for example 10 p.m. and get up at 6 a.m. than they had previously. Now, another thing you can do is as soon as you get up, get outside and walk in the bright light. And you need the whole sky up above coming in. So don't stand next to a building or under a tree. And this triggers the brain into spring. You don't have to have the sunlight directly shine on you. You could even read the newspaper, but just don't bend over like this. Keep your face up so your visual field has all that light. This treatment is also used indoors with light boxes, where you buy a light box that usually people set it on a desk and you have to stare at it for about a half an hour. The problem is most people don't get close enough to the light, and then they don't have enough light to make a difference. You need what's called 10,000 lux, and with most lights that means being about a foot away from the light. And you could read if you put the reading material down lower so that your visual field is filled with this light. And this light therapy, whether it's walking outside in bright light or doing it inside, generally begins to lift your mood in just a few days, and often in a week you're up to normal. Especially if you're a seasonal person, and people with seasonal depression have noticed that they're more depressed in the winters, and they tend to sleep too much during the winter. And they're often fair-skinned people with light eyes and light-colored hair. But that's not always the case. There's a few other behavioral things that you can do, or your spouse can make you do. One is to act as if you're not depressed. If If you have a wedding to go to and you don't want to and you're too depressed, it'd be a really good idea for your wife to force you to go. Because if you go, you have to smile, you have to talk, you have to be with people, and it will not make you worse. And it's got a high chance that it'll help your depression a little bit. In fact, there was a study where they had some people put a pencil in their lips and other people put a pencil in their teeth, and they compared their mood. They had a sophisticated way of doing this, and they told them that they were doing this experiment to see how elderly people should hold pencils, I guess, something like this. And it turned out that the people that had the pencil in their teeth had more of an antidepressant effect. And it's because the smile muscles are activated, and then that has an effect on you. And there's also a study by, was a paper that was by Norman Rosenthal, I believe, showing that people who had their forehead injected with Botox had a significant antidepressant effect at 6 weeks. And this is apparently because the frown muscles were paralyzed and they couldn't frown so readily. And they did the experiment very well because the plastic surgeons gave half of people Botox and the other half of people saline solution, and the surgeons didn't know who got what. And then when the people were tested 6 weeks later, the people that interviewed them while they had a cap on, so they couldn't unconsciously see whether the person could frown or not. And there was a significant benefit. And I think also that the plastic surgeons had noticed themselves that when they injected that area, that people became less depressed. Now, there's a few other things. One is to, besides forcing yourself to do things, one is to exercise. And the amount of exercise you need is a lot. It should be relatively vigorous, 5 hours per week. The minimum dose is 3 hours per week. It's sort of like Zoloft, sertraline. The maximum dose is 200 milligrams, and the minimum dose is 50. And with exercise, the maximum dose is 5 hours or even more, but the minimum dose has to be at least 3 hours. And you could probably shorten this if you did extremely vigorous activity for 5 or 10 minutes at a time, like in interval training, so much activity that you're very winded. Then you might get away with less total time. And another thing you can do is to turn off your own negative thoughts. And this is easier to do than you think. If you start feeling guilty about something in the past, and then you're going to go down this whole series of thoughts about if I had done this and if I had done that. Well, you've thought this through 1,000 times before, and you're not going to come up with anything new. And you have to tell yourself, why am I thinking about this? And just say, I'm going to stop. You can't stop the first thought popping into your mind, but you don't have to go down the road. You can force yourself to think about something else or go read a book or something. And likewise, you can develop some more positive thinking by reframing things. When something happens, you can think about what's the good part of it. So if you've failed the law boards twice and now you finally passed it the third time, you could think, oh my gosh, I'm not very smart, I failed it twice, or actually I'm pretty lazy that I didn't study hard enough, and most other people did better than me, and you're blaming yourself, rather than think, I didn't pass the first two because I didn't study very hard. This time I studied harder, and I did it. And in the future, I should just make a little bit more effort to study when I have something to do. Anyway, those are some behavioral ways of helping to control depression, and these things also help prevent you from sliding into depression.